Health, the Maryland chapter, seeks to educate our elected leaders, the media, and the communities we serve about the important contributions biotech and pharmaceutical companies and their employees make to the health and economic security of individuals, local communities, and the state of Maryland. It's a grassroots initiative that unites health consumers, biopharmaceutical company employees and retirees, vendors, suppliers, and other businesses, academic and community partners to demonstrate how these diverse groups work together to improve America's healthcare system and strengthen our economy. One of We Work for Health's core principles is supporting STEM education and connecting Maryland bioscience employers with our future innovators of Maryland to assist and guide young Marylanders toward a career path in math and science. Today's event is about connecting those students with Maryland's biotech workforce and truly close the loop between the classroom and the job market.
Friends, I share your support for STEM education programs for our children. This is an investment that creates jobs and meets a compelling need.
There's a big demand for scientists and technicians in our workforce. So there's always the possibility of finding jobs in Maryland and throughout our country in the sciences.
Well, the coalition is really important, and MedChi is one of the co-chairs of it because there's an incredible shortage of science and math majors and kids in America. And specifically for our industry, we have a shortage of physicians, and we need more kids going into math and science so they can grow up and end up being physicians here in the United States, and particularly in Maryland, where we have an incredible shortage of doctors.
STEM education is the most important kind of resource now that we can provide to the next generation. It creates jobs. It's going to put our economy on the cutting edge. It's going to cure diseases. It represents the best of innovation. And Maryland is really at the center of this. And I do have to mention that at the center of some of these budget battles that we're engaged in right now in Washington is a discussion about the level of investment we should make in STEM education, in research, in science. And I'm an advocate for that. I know everyone standing here is an advocate for that, and you as students, when you get in there and you participate in this and you continue your careers in science, you're going to become advocates for that, and that's what's going to keep America moving forward.
What's important for us is these are the future folks that are going to be able to come and populate the industry and academics. So why we think this is important is investment in the kids today is going to pay off in the future. You think about the economy, what's happening is things are moving towards more science and technology. So the foundation of what they learn now is going to actually help them and help, for example, my company, MedImmune, as we hire people 5, 10, 15 years down the road. So it's incredibly important. The kids get that basic understanding now, which will serve them through college and then in the job market.
In our industry, with the advent of health system reform, we have an incredible need for healthcare providers generally, but specifically for physicians. That's why it's so important that we're making sure kids understand the importance of science, math, and these types of skills that they need so they can be successful and go to medical school. We are going to be putting thousands and thousands of people on the healthcare rolls in Maryland, and they're going to need doctors. And obviously we need smart kids who know science and math so they can go ahead and be physicians when they grow up.